Good afternoon, guys, and welcome to the Tuesday afternoon kitchen talks. My name's Paul Corliss. I'm a healthy lifestyle advisor at Your Live Wire. So Tuesday afternoon, we have different health subjects. 3 o'clock, we had cardiologists, nutritionists, dietitians, performance lecturers, professional rugby league players, different health subjects, different topics. So today, I'd like to welcome a good friend of mine, senior physiotherapist, Mr. Stephen Egerton. Welcome, Stephen.
Hi, Paul. Nice to see you.
Thanks for coming into the kitchen talks. So today's subject is 80% of the population will experience this problem at some time in their lives, and 264 million lost working days to this problem. So the problem we're talking about, Steve, is back pain.
Yeah. So as you just said, back pain is the most common reason for anyone being referred into our physiotherapy service. It's something that affects, as you said, 80% of the population over the course of a lifetime. And I think the research is suggesting that most of us, or at least 50% of us, might experience some back pain over the course of a year. Thankfully, for a lot of people, that back pain will be short-lived, lasting for about 2 to 6 weeks before gradually getting better. Unfortunately, for some people, it can become a more persistent problem, and that's often when we get involved as physiotherapists in helping to manage and look after people with more persisting back pain.
Absolutely, and I deliver a lot of the community cardiac rehab, and the advice has sort of changed over the years. I remember when a long time ago, when people had heart attack, it was go to bed, you need to lie in bed, let your heart recover. And same with back pain, as when people got an acute back pain, they would told to bed rest. But the advice is for both subjects is we get people a lot more active in reasonable levels, or when they've got back pain, to keep on moving now and do the day-to-day activities within a reasonable pain threshold.
Yeah, that's definitely been a big shift in the way that we look after back pain. We now know that bed rest and avoiding physical activity, and specifically becoming avoidant of particular movements that are painful, actually doesn't help the recovery and may well slow it down. So as you quite rightly said, we want to try and help people to feel confident enough to get moving as soon as is practically possible. One of the things that people can use to try and enable movement in the early stages is good pain control. And current guidance is that simple over-the-counter pain relief is more than adequate for the vast majority of back pain. Where people don't feel confident to use over-the-counter medication, we would be recommending a conversation with a pharmacist or their GP. And of course, if over-the-counter pain medications are not successful at managing the pain, then definitely a conversation with someone's GP is going to be helpful, as we know that good pain control will help to make people feel confident and able to move as soon as is practically possible, and that very much is important to getting a speedy recovery.
Absolutely. And the statistic I said at the start was 264 million lost working days due to bad backs as well. And I think generally keeping fit and well, and I mentioned last week when we had Dr. Lizzie Deary with us, and we talked about physical activity in the workplace, and I've opted to a bit more of a standing desk at home since I've been working home as well. Do you think there's things we should do in the workplace? I know I've seen with employees I've worked in the past, they have specialist chairs, the adapt things day to day to manage the back pain. Do you think stuff like getting like a specialist chair to help back pains within the workplace?
So it's a good question. So to try and prevent back pain, we know that specialist chairs are not necessarily required. So historically, we might have blamed posture and certain working practices, lifting, bending, twisting, as being a cause of people's back pain. I think we're now learning that actually backs are meant to bend and twist, and there is nothing inherently wrong with sitting in certain positions, slouching, all of these activities are not going to cause someone to get back pain. However, we know that it's important to remain physically active. If we are doing repetitive activities and your workplace offer a work-based assessment or a health and safety assessment, then of course that's something that we would advocate if the workplace has identified that. But in terms of people requiring specific chairs or maintaining certain postures or avoiding lifting, bending and twisting, currently the thought process is that actually doing those things is not going to prevent back pain, and actually the spine is more than resilient enough to do all of those things as long as we're looking after our general health at the same time.
Absolutely. We mentioned about general health. There's lots of research coming out. Obviously, we know weight is a big side of things in obesity. Obviously, more strain on coming onto the back, and that's an area we can work with a lot of patients on. Obviously, there's been a lot of research coming out about smoking and back pain. What's your thoughts on that, Steve?
Yeah, so I think what we're increasingly learning is that back pain is very complicated. In about 85% of cases, it's hard for us to blame one particular thing for why someone might have back pain. We do know that lifestyle factors, particularly those lifestyle factors that we're all learning are commonly associated with a range of health problems, seem to be associated with more problems when people get back pain. So as you mentioned there, that yes, if people are carrying excess weight or they have other significant health problems, lifestyle related health problems, diabetes, smoking and the such like, that potentially that might be a contributing factor as to why that they're having difficulty overcoming their particular episode of back pain. I think the key thing is we'd say that no one of those factors is going to stop someone getting better from back pain, and that we would try and look holistically at someone who is experiencing back pain that isn't settling down, and those things that we can help them to change, and we would try and do so. And particularly, as you know, we'd work with you guys in lifestyles, helping to signpost and direct people with back pain who have some of these other issues that we might be able to help with to your services, where they can work with the smoking cessation team, or like you said, work with weight management. And yeah, I think the key is to look holistically and really help to improve someone's general health. And by doing so, we do know that will help someone overcome or certainly significantly improve their back pain experience.
Yeah, and as we know, there's a lot of contributors, a bit of a minefield, back pain, because there's so many different causes and lots of things what affect it. And you mentioned about the holistic effector side of things. So it's probably good to do when you've got someone's back pain, doing a total holistic needs assessment on what they need. So looking at the nutrition, the hydration, the sleeping, the smoking status as well, and social isolation and stress and anxiety. We know it plays a big part in pain as well. Or looking at, there's a lot of, especially in pain clinics now, there's a lot of therapy starting to happen, isn't there? More cognitive behavioural therapy, more psychology behind pain.
Yeah, so I guess sort of going back to the earlier point, so most of us will experience back pain at some point in our life. For most of us, it'll be hard to identify what necessarily the cause was, and it'll be hard for us to particularly blame a specific structure in the spine. When we do get back pain, thankfully, the vast majority of us, the pain will settle. We know that for those people who are still getting persisting back symptoms at 6 weeks, and it's still having a significant impact on their daily life, that yeah, having a holistic assessment with, for example, in our service, a physiotherapist, what we would then do is we would then explore all of the different things that are unique to that particular person that may be contributing to why they're having as many problems as they are with their back pain, and where we can identify these barriers, these things within their life that are making their pain experience more challenging, we will do our best to give advice and guidance on the areas that we're specialist in, but signpost elsewhere. So yes, one of the things we've learned a great deal in physiotherapy over the last few years is the importance of those lifestyle factors such as sleep, our diet and our general health, but very important, as you brought up, our mood, how well we're coping, our work. All sorts of different factors will contribute to why someone might be having problems with their back pain, and we would try and help someone to understand those problems and what changes we could help them make.
Absolutely, and a lot of the when people get an acute injury or they pull something or they're lifting something in the garden and then all of a sudden they feel like a pain in the back or the side, and a lot of people say, "Oh, I'll go and use a hot bath," but when sports people get an injury, we put ice on it. So sometimes people get a bit confused. Should I put hot on it? Should I put ice on my neck? Should I have a warm bath? Should I have a warm shower? So what's your thoughts on self-management at home? Obviously, you mentioned about the over-the-counter painkillers.
Yeah, so interestingly, you always see lots of debate around whether hot or cold is beneficial, or particular types of rubs. I think the guidance would be that the physical activity bit is probably the most important. We know that over-the-counter pain medications seem to work for a lot of people, not everyone, but a lot of people. And then really it's down to personal preference in terms of if applying a hot pack to the painful area alleviates the pain, that then enables you to be able to move more and to gradually get back to the things that you enjoy doing and want to be doing, then heat is right for you. If applying heat to the area is not giving you any relief or making the situation worse, then it's not right for you. So I think it's down to sort of personal preference. With things like heat and cold, we're looking for that immediate alleviation and reduction in the pain intensity and experience that they've got at that moment in time. In terms of those things significantly impacting on your body's ability to mend, if we're talking about sort of tissue healing, that's a little bit more uncertain. And I think the key thing is that the body does have an incredible capacity to heal and mend. So when we damage the various structures that make up the spine, the body does have this capacity for those structures to mend, and most structures will mend over a 6 to 12 week period of time, independent of what medicines we take or what creams we apply or whether we do or don't use hot and cold. Again, the key thing would be to gradually start to get back to normal levels of activity where possible, as early as possible, and that will be the best thing we can do to accelerate our recovery and prevent us developing sort of secondary issues associated with being less active, such as things stiffening up, us losing our strength and fitness, and of course the effects on our mental health of not getting out and not being able to sort of do the things we love and are important to us. So it's really the physical activity that's very important.
Absolutely, because I used to think a long time ago, so I can't do that. I've got a bad back. It'll make it worse as well. But we want people moving, don't we, and being physical. And if people are struggling to find an exercise, obviously you can still get referred into Livewire, and you can speak to one of the exercise referral advisors like myself, and we can decide what exercises for you. We put some really good online Tai Chi sessions, some strength and mobility sessions, chair-based exercise sessions, and hopefully as things get a little bit better, we can start getting into water-based stuff. And people, especially with back pain and a lot of the new osteoarthritis of the hips and knees, stuff like walking in the water is very good. It's a very good strength exercise, and people say that the buoyancy of the water is really helpful. So if someone has back pain, Steve, obviously they do their self-management, so the painkillers, the therapy, the activity, the rest, and then the back pains still get persistent problem. Should the first protocol to access the back pain service is go and see the GP for referral, or can people self-refer into the service?
Yeah, so at the moment in Warrington, if you wanted to see a physiotherapist through the NHS for your back pain, it would need a GP referral. So you would have to contact your GP and they would refer into our service. what we typically advise is, as I said, that for the vast majority of people, thankfully, the back pain will gradually ease within a 2 to 6 week period of time. For that reason, in those first 4 weeks particularly, we know that actually seeing a physiotherapist may not be the best thing. It may not add a great deal more benefit than simply following the advice and guidance, which is to remain as active as possible, performing some simple exercises which can be found on the NHS Choices website if you look specifically at their section on back pain, or going onto the Chartered Society of Physiotherapy's website, and they too have some simple exercises. So in those first few weeks, simply following the guidance that we've just talked about, doing some of the simple exercises is certainly the best way forward. If someone's back pain is not settling within that time period or is worsening, then we would certainly suggest that you gave your GP a call, as that is the current pathway in Warrington, and they will advise you. And if they feel that further assessment and support is required, then they would refer into our service. And of course, they will give you the right advice and guidance for what they feel is best, depending on what symptoms you present with. Once you access our service, we would then bring you into clinic and conduct a physical assessment and understand some of the reasons why the back pain is causing the problems that it is, as well as trying to give sort of the right guidance that we can in terms of helping to bring about a speedy resolution for that problem. Currently, with COVID-19, we aren't able to bring people into clinic, although that may well change. So at the moment, we're offering telephone and video appointments. So at the moment, if you were to experience back pain that was persisting beyond 6 weeks, or it is worsening within that 6 week period and you're struggling to cope, we'd urge you to contact your GP, who would then generate a referral into our service, and someone from our team would then be in touch to offer an appointment, either telephone or video.
Absolutely. So there's help out there, and top tips today is lifestyle first, exercise, and then the help's there if we need it. So thank you very much, Steve, for coming down to the Health Kitchen, and thanks for your best advice, and hopefully we don't have to see you in clinic if we get any back pain. So thank you, guys. Make sure you stay safe, keep washing your hands. We'll see you next week for the next episode of Kitchen Talks. Thank you, Steve, and I'll catch up with you soon.
Thanks, Paul. See you later.